Dental anxiety or fearing the dentist is a problem that many people have and something that is somewhat difficult to overcome. This fear normally prevents rational people from visiting the dentist and maintaining the health of their teeth. The key to keeping your teeth healthy is to prevent problems before they start. And those who suffer from dental anxiety will try to avoid going to the dentist, which results in problems. When someone who suffers from dental anxiety finally goes to the dentist, they normally find that even the smallest of problems can turn serious and require a lot of work and intervention from the dentist. Even though you may not realise it, regular visits to your dentist is the best way to keep your teeth healthy and prevent problems such as decay and cavities. You can use several techniques to overcome dental anxiety. Some of the techniques require mild sedatives, also referred to as sedation. Sedation is a way to relax. It's given by breathing or IV intravene through a vein in your arm. Sedation will help you to calm down, although you will normally be awake to answer questions or talk to your dentist. Some people who suffer from dental anxiety have had bad experiences. Any type of negative dental experience will normally result in emotional scarring and last for years. Anything that results in negative feelings for the patient will normally cause them to feel in a negative way towards the entire dental profession. Although all dentists aren't bad, a negative experience will certainly make a patient feel that way. When you look for a dentist, you should always ask your family and friends who they use and who they recommend. When you visit a dentist, you shouldn't hesitate to ask him any questions that come to mind, so you can be more relaxed. You should always keep in mind that you are the customer, and the dentist is the one who needs to make you feel relaxed. Never should you feel intimidated, as the best dentists will do everything they can to establish a sense of trust. Establishing trust is very important with the patient-dentist relationship. You'll be going to your dentist on a frequent basis, so you'll want to be sure that you can trust him. When you go to your dentist for the first time, you should let him know about your dental anxiety. If he isn't willing to talk about it with you or do things to help you relax, you should look into a new dentist. You can always tell who the better dentists are by the type of facilities they have. Dentists who have a lot of customers or nice offices have established themselves and proved that they are indeed the best. If a dentist has a lot of customers, it lets you know that he has them for a reason. People that are satisfied with a dentist normally return. If you suffer from dental anxiety, you should always let your dentist know in advance. Over time, you'll find that you can overcome your fear and establish a great relationship with your dentist. It will take you some time, although your dentist should be willing to work with you on that. But before you know it, you'll be over your fear and more than willing to go to your dentist. Brushing and flossing are something we all learn at an early age. The proper way to brush your teeth takes less than 2 minutes, although many people tend to spend much longer or much less. Most adults tend to spend less than a minute, which isn't enough time to clean your teeth. To get the right amount of time brushing, you should try using a stopwatch while you brush. When you brush your teeth, you should avoid using pressure, but instead use short, gentle strokes. You should focus on hard to reach places and make sure that you get the areas between your teeth as well. You should also make sure you get eating surfaces as well, along with your upper and lower gums. If you focus on all areas of your mouth, you'll get everything when you brush. Along with using the proper brushing techniques, you will also need to use the right toothpaste as well. There are a variety of toothpaste available, designed to help you with a variety of different conditions. You can get toothpaste that will prevent toothaches, stop sensitivity, and prevent things such as tartar and gingivitis. Toothpaste is the best way to protect your teeth, therefore you should always ask your dentist what type of toothpaste he recommends for you. To get the most out of brushing, you'll need to have a good toothbrush. There are many different models to choose from, which can make it extremely difficult to choose one. When you make your choice, you should look for brushes that have soft bristles. Soft bristles are easy on your gums and they will remove plaque and other debris from your teeth. A small head is also preferred, as it can easily reach hard to get places such as your back teeth. You should also remember to replace your brush every couple of months or when it starts to show signs of wear. If you've had a cold, you should replace your toothbrush simply because the bristles contain the germs that could get you sick all over again. Toothbrushes that show wear should always be replaced, as they can have an impact on your gums. If the bristles start to get worn down, they can tear away your gums, leading to sensitivity. To get the most from your brushing, you should always use a bit of common sense and ask your dentist for his recommendations. Brushing your teeth will help keep them healthy and prevent the build-up of plaque and tartar. Keep in mind that brushing does help your teeth, although you still need to go to your dentist for regular checkups. If you take care of your teeth and brush them on a regular basis, you will keep them free of infections and cavities. Along with brushing your teeth, you should also be flossing on a daily basis. Flossing will remove plaque and debris in areas that your toothbrush isn't able to reach. A build-up of plaque can lead to gum disease or tooth decay, which is why flossing is very important. If you floss immediately after brushing, you'll notice that your gums and teeth will be much healthier. When you look at dental floss, you'll notice there are two types, nylon and single filament. You can get nylon either waxed or unwaxed in several different flavours. Nylon floss is made up of several strands of nylon material, meaning that it can shred, tear or snag between the teeth if it gets caught up on sharp teeth. Even though the single filament floss is more expensive than nylon, it will slide easily between the teeth, even tight areas and spaces. Unlike nylon, single filament is impossible to shred or tear. No matter which type of floss you choose, as long as you floss regularly, it will move debris from your teeth and gums. If you've never tried flossing before, you will probably be amazed just how much debris and food particles it can remove. Flossing is recommended by dentists everywhere, as it can reach places that even the smallest of toothbrushes can't. Food and debris will build up between your teeth, which makes dental flossing very important. The main problem many people have against flossing is the fact that it can result in bleeding of the gums. Anytime you floss and get between your teeth and around your gums, the floss will rub against your gums, resulting in bleeding. Many people take this the wrong way and immediately stop flossing, usually for good. Bleeding is very common and should be expected with flossing. When you brush your teeth, you miss a lot of food particles and debris that continues to build up in your mouth. No toothbrush is designed to get every area of your mouth, as all of them miss hard to reach places. With the areas missed by the toothbrush, the debris and plaque will continue to build up until they eventually result in a cavity or decay. To get this debris and plaque before it builds up into something more serious, you'll need to floss. If you've been afraid to try flossing due to the bleeding, you should really get over that fear and floss after you brush. To keep your teeth and gums healthy, you ought to brush and floss your teeth. Regular checkups with your dentist will help as well, although it is up to you to continue your regular maintenance at home with flossing and brushing. If you floss on a daily basis, you'll quickly realise just how clean your teeth and gums will be. As millions of people all around the world know, sensitive teeth can make life in general a nightmare. Sensitive teeth comes with pain and discomfort that can make eating or drinking your favourite foods a painful experience. Although you may suffer from sensitive teeth, you can rest assured that they can be treated. Normally this condition presents tooth pain after drinking cold liquid, eating hot or cold foods, or breathing cold air. If the pain becomes too much to bear, you should immediately see your dentist, as the nerve of your tooth could be exposed. Normally, sensitive teeth starts when the gums begin to pull away from the teeth. With the gums being a protective blanket, they cover and protect the teeth's roots. And when the gums recede and pull away, the roots have no protection and therefore they will be exposed. The exposed root tips contain small tubules that lead directly to the nerves of the teeth. Whenever pressure, hot or cold elements travel down the tubules, it will trigger the nerves and result in pain. Those who don't have sensitive teeth will have their gums covering the tubules, which prevents these types of things from happening. The idea here is to stop tooth sensitivity and keep the gums healthy. If you reduce the pressure you use when brushing your teeth, you'll find that your gums will remain healthy. When taught to brush their teeth, most people are instructed to use a lot of force. And while this can get the teeth clean, it will also tear at the gums, which can lead to sensitive teeth. If you have sensitive teeth now, you should try using an electric toothbrush such as the Sonicare Advanced. Although you may have sensitive teeth now, there are ways you can help to improve your gums and your teeth. There are several toothpastes out there on the market that contain potassium nitrate, which helps to reduce pain and discomfort associated with sensitivity. Although there are several toothpastes to choose from, sensodyne is the preferred. It's recommended by dentists as being the best simply because it affects the nerve of the tooth and stops the pain where it starts. Mouthwash can also help tooth sensitivity, providing it contains fluoride. You can also ask your dentist which mouthwash he recommends, as there are several to choose from. Scope is a great brand to use, as it offers you plenty of fluoride without any alcohol. Unlike Listerine, Scope won't burn your mouth when you use it. It will leave you with a clean feeling and get your mouth and teeth completely clean, killing millions of bacteria. If you start using fluoride toothpaste such as Sensodyne and mouthwash, you'll notice a big improvement in your teeth and gums. The sensitivity will begin going away, giving you almost immediate relief. When you brush, make sure you brush gently and avoid using any type of force, as it will always cause your gums to recede again. In the event that using Sensodyne and fluoride mouthwash doesn't help, you should ask your dentist about other options available to you. Your dentist will know what will help you, so you shouldn't hesitate to ask. He will also know how to eliminate your sensitivity once and for all, and how to prevent it from coming back. Tooth sensitivity is something that many of us have to deal with, although there are ways that you can fight back and prevent the pain and discomfort associated with sensitivity from making your life harder than it has to be.